Hi, I'm Dr. Nick Walters, talking to you from Mission Hospital in Bangkok, and I'd like to talk to you today about the COVID vaccine for children. As you may be aware, the Ministry of Education for Thailand is requesting that students ages 12 through 17 be vaccinated against the COVID vaccine. But many parents have heard rumors about COVID vaccines and are worried about their children. They're worried that their children are going to have problems due to the vaccine. And so I'd like to talk to you about the benefits and the problems due to the COVID vaccine for children, specifically the Pfizer vaccine. The Pfizer vaccine is no longer an experimental vaccine. It has been approved for use in adults and children. For children ages 12 through 17, it's been approved for use here in Thailand and in the manufacturing country of the United States. So this is no longer an experimental vaccine. This is a vaccine that's been well proven. Now, the benefits of having the vaccine are preventing COVID infection. But many parents will say, well, the COVID doesn't cause too serious of problems in children, so why should my child be vaccinated? It's partly for your child, so your child doesn't get COVID infection, and partly so that your child doesn't get an infection and spread it to more sensitive members of your family. I'll give you an example. I have a patient who is age 12 years old, and she got her COVID infection from her friends. She came home and spread the infection to her parents, and her father now has pneumonia due to COVID. So because of this, there's a high risk for having problems by spreading this infection, and the vaccine is intended not only to protect the child, but to protect people at home due to COVID infection. Now, I'd like to talk to you about the side effects of the vaccine and the problems with the vaccine. So I'll be specifically speaking about the Pfizer vaccine in children ages 12 to 17, which is the group that we're talking about right now. So what kinds of problems can the vaccine cause? Well, there have been several large studies done in the country of manufacture, which is in the United States, where millions of children have been vaccinated with this vaccine already. Now, most children do very well with the vaccine, but I want to give you some statistics that tell you a little bit about the side effects of the vaccine. The vaccine itself is 2 shots, and they're given about 3 weeks apart. And with the vaccine, the kinds of side effects that we commonly see are feeling of fever, body aches, and feeling of tiredness. And this can happen in up to 70% of children who've been vaccinated with the vaccine. These symptoms last about 1 to 2 days and then get better. So no serious problems happen usually within the first couple of days. But many parents have heard about a more serious complication due to the COVID vaccine with Pfizer in children, and so I'd like to talk to you about that next. The problem I'd like to talk to you about with the Pfizer vaccine in children is inflammation of the heart, and you may have heard this as being a side effect due to the Pfizer vaccine. And so I want to speak specifically about this. The medical word for this inflammation that they're talking about is myocarditis and pericarditis. This is basically, myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the tissue surrounding the heart. Now, is this a common side effect? No, it's very rare. In fact, it's only been discovered and reported in just a few people. I'll give you some statistics on this. There was a study done among 2 million children in the western United States, such as in Washington and California, and of these 2 million children, they reported 20 children having the myocarditis and 30 children having pericarditis. Of these children, all of them got better within a few days, 4 or 5 days, and None of them died from it. And all of them were treated with very simple medicines that we often use for fever or body aches, such as ibuprofen. So the side effect of this inflammation primarily presented as a person with feeling some chest discomfort and some tiredness. And then when they were checked by their doctor, they found out, oh, they had myocarditis. But when they were given these medicines, they got better. This is not a life-threatening condition, and it's something that got better by itself. But like I said, out of 2 million children, only 20 of them have been reported for the myocarditis and 30 for the pericarditis. So it's a very rare condition. Let me talk to you about the opposite side of things. During that same group, that same period of time, thousands of people died from the COVID infection in the same study area due to not getting the vaccine. In fact, the majority of people who are dying right now from COVID are people who have never been vaccinated. So when we look at the benefits and the risks of the vaccine, there are some rare risks, but not life-threatening. But not getting the vaccine, the risk is much higher. People do die. Here in Thailand, depending on when you hear this video, 100 or more people are dying per day. And the majority of those people didn't get the vaccine, and it's a preventable condition. And so I would recommend you consider this. If you'd like to go for further information, you can search it on the internet, but I would recommend going to a reputable internet site, such as the World Health Organization site or the Centers for Disease Control and Prevention in the US, or the Minister of Public Health for Thailand.